Hey everyone, with endometriosis, there's a really cool new study that came out. And when I work with endometriosis, I always tell patients there's three different main causes or root causes of endometriosis that we want to address. And one of those very important causes is something called oxidative stress. So, oxidative stress is a type of chemical stress that occurs at the cellular level. And this oxidative stress is related with something called reactive oxygen species, or ROS. And these reactive oxygen species tend to imbalance the electron configuration within the DNA strands of cells. What ends up happening with this is it can damage the eggs that are close to it. For example, if there is endometrial tissue close to the ovary, or there's an endometrioma or a chocolate cyst, as it's called, it can actually decrease the quality of follicles and eggs, which can have huge impacts on fertility rates, IVF, pregnancy rates, etc. And also, we see that when we have a chronically increased level of oxidative stress, it actually triggers inflammation. So they go hand in hand. The immune system will secrete certain types of proteins, which will trigger more inflammation in that area. So it increases inflammation and oxidative stress. So the body has an inherent built-in system to deal with this, and it's what we call the antioxidant system. And the antioxidant system is equipped to deal with this oxidative stress and decrease its negative impact on fertility, on the reproductive organs, on the follicle health, etc. But we can only use that antioxidant system to a certain extent, and it can become overwhelmed. And this is something that can happen quite often with endometriosis. And this is simply because their level of oxidative stress is much higher than the antioxidant system was built or equipped to deal with. So I kind of think of it like a seesaw. Usually should be fairly balanced, or antioxidants should be higher. And if oxidative stress is higher than the antioxidant capacity, then we start to see more oxidative stress and damage related to it and inflammation. So to deal with this, a few different studies actually use the same protocol, this new clinical trial that was published recently used. And they basically combined vitamin C and vitamin E. And they used both of these treatments for patients with chronic endometriosis for 8 weeks. And they measured before and after a lot of chemical different mediators or markers for inflammation and oxidative stress, and also symptomatically what changes or improvements were seen. And they had a control group which got placebo during those 8 weeks, and it was compared to the control group as well. So just to mention like some of the parameters they were measuring, symptomatically, some of the main things we worry about or see in patients that have endometriosis, they tend to have chronic pelvic pain. So this is not related to the period. It's there potentially all month long and can in many cases be very debilitating. So this was something that was measured symptomatically on a pain score. And the second one is dysmenorrhea, so pain during menstruation. So very painful or significant and severe cramps are a unfortunate side effect or symptom of endometriosis. So this was again something that was measured before and after treatment. And the third one was dyspareunia, so pain during intercourse, which is quite problematic for patients with endometriosis as well. So it was compared before and after the 8 weeks of treatment. And basically, after the 8 weeks of treatment with something as simple as a vitamin C and vitamin E, which is really just like the tip of the iceberg when it comes to potent antioxidants for endometriosis, they saw a significant reduction in the amount of pain experienced during menstruation, during intercourse, and there was a significant reduction in chronic pelvic pain. And when that was compared to patients in the control group, they saw very, very mild decreases in pain during menstruation, and they actually saw an increase in the amount of chronic pelvic pain on the pain score. So we're seeing that the control group in general started to have more pain, and the treatment group that got vitamin C and vitamin E actually saw a very significant decrease in those pain scores. And similarly, there's actually a marker in the body known as MDA, and MDA is used to measure the amount of oxidative stress in the body. And they also saw on testing that the MDA levels were significantly decreased after using the vitamin C and vitamin E compared to the control group. So this is actually telling us that, just because sometimes somebody takes a treatment doesn't mean it's actually working on the molecular level. And in this case, we see that it does. So it actually does seem to decrease the marker for oxidative stress for these patients with chronic endometriosis. And while this study is very, and I would say, um, groundbreaking almost because it's playing on how something as simple as antioxidants may actually have a huge impact in having or even having further reductions, greater reductions in pain with a debilitating condition like endometriosis. It provides a really good adjunctive therapy to look at that might be safe for some patients to use, instead of, or to use instead of, or use along with, anti-inflammatories, over-the-counter pain meds, which can often come with a lot of other side effects with long-term use. So for patients that are using that for 2 weeks at a time for every month, it can become problematic over the years in some cases. So it's good to have a chat with your licensed healthcare provider, your naturopathic doctor, or your family doctor about using something like vitamin C and vitamin E. And this study was actually building on research from a previous trial. So it wasn't the first trial that looked at this combination of specific doses of vitamin C and vitamin E. There were actually previous studies that looked at this as well, finding similar outcomes, and this was trying to reaffirm or reestablish whether they could replicate those results as well. And so if you want to learn more about this, you want to read more about the dosing, etc., that was used in the study, head over to our website, and we've published a nice blog post on this, overgoing a lot of the important and critical information from the study, and information you can share with your healthcare provider as well. And as always, if you guys have any questions, send me a direct message or drop a comment here, and we'll be happy to respond. All right, take care, everyone.